Hello, welcome to another broadcast of Cutting Edge Pain Relief and Biohacking Your Pain. Today, I'm honored to have a phenomenal guest, to have Dr. Marchetti with us, who is going to talk about the aspect of stem cells. He is an author of a well-renowned book that's called that's called A Buyer's Guide to Stem Cell Therapies. Safely choose the right regenerative treatment for you. He is a cum laude graduate of University of Texas, as well as UT Southwestern Medical School, and has done numerous things, including research for the Department of Defense on neurofibromatosis, as well as worked at the renowned Texas Back Institute. It is a pleasure to be joined by Dr. Jason Marchetti. Thank you so much for being here with us.
Thank you, sir. Appreciate it.
Dr. Marchetti, it's a pleasure. So you've written this textbook, and it's, I guess, maybe not even quote unquote a textbook per se, but it's a book that goes line item by line item and gives explanation for people that don't necessarily have a background in regenerative medicine. Is that correct?
Yeah, and you're right. It's not a textbook. It really is for lay people, as opposed to a clinical, education piece. And it's only available as an ebook through Amazon. And part of the reason for that is, as you know, as you've gone through the book, I have hyperlinks to different, abstracts and things like that when I reference studies. And it just seemed like a more slick way to kind of enable people to, if they wanted to delve into kind of more of the science side of things, to give them the option of that. But I didn't want to have a book that was kind of so overwhelming from the science perspective that it lost a lot of people. And so that's kind of the reason that I strategized it that way. But I think overall it's a very easy read for people, who aren't necessarily really, strong in the science, but at the same time has all of the references for people who want to take a deeper dive.
Phenomenal. So let me just make sure our audience understands the degree of expertise that you have. So you've done multiple different certifications in regenerative medicine, not just stuff where you read a little bit, but being hands-on and living it in a day-to-day practice. And that's really kind of, I assume, where some of this came from. And I would gather maybe it was the aspect of patients asking you questions and it kind of prompted you, but that's me going off my cuff. Can you tell me, how'd you get involved with regenerative medicine and why'd you write the book?
Sure. So I spent really the first probably 11 years of my career practicing, what people would call pain medicine. And so my background is I'm a physical medicine and rehabilitation specialist. And so I was with an orthopedic spine practice, which is primarily a spine surgery practice. And, was doing traditional injections and spinal cord stimulators and rhizotomies, and prescribing pain medications, all of that stuff, which was fine. But as time went on and we started having the opiate crisis and things like that, I started looking at regenerative medicine more. And as I think the science in that area has grown, I became more interested in it. And so I left that big practice in 2016 and basically went out on my own and started doing more and more, training courses and researching in order to do regenerative orthopedics. And during that process, obviously, as you kind of start looking out there in the world as far as, what are people offering, and, you start seeing some of the things that are being advertised to patients, it was concerning to me that, there's a lot of practices that are, kind of overselling stem cells and not really disclosing exactly what they're doing. And if you look at some of the education pieces where they'll have a pretty cartoon about, a knee joint, it looks all worn out, and then somebody comes in with a needle and it, regrows all the cartilage. And so there's almost this propagation of this notion that Regenerative medicine is going to make everybody young again. And the reality is at least in our current form of it, that's not really what we're finding. That's not really what should be promised. And so I wanted to write a book that really helped people understand, what is regenerative medicine? What is stem cell medicine? How is it applicable to orthopedics? And also give them tools to be able to scrutinize, a lot of the advertising that's out there, or a lot of the products that are being sold out there. And at the same time, because it is a rapidly evolving field, every month there's new studies coming out. You can't just write a book at one point in time and say, here's what the truth is, because it changes. And, again, we get more and more information all the time. And so, I wrote this book a few years ago, but I think the education piece in it is still applicable today. You still have all of the same resources, or still all the same steps that people can go through to scrutinize, what is out there in the literature right now for whatever their problem might be, or whatever technology they're looking at. And what are the questions that they should bring to their provider, their doctor, when they are thinking about any sort of regenerative medicine sort of treatment.
Okay. So to that end, I've done a number of interviews and been on both sides of this coin, right? And I know as a doc, and again, I thank you as a guest, for us, we know that most of our topics are very nuanced. There's a lot of pieces that are in play of what sometimes are glossed over when you have non-healthcare professionals kind of just bottom line it. But I'm going to step out for just one quick second and say, at the end of the day, it sounds like you're trying to give people the resources so they can find their own truth and have an idea about some of the glossy flashiness that may be out there at times may not be all that is cut out to be. Is that too oversimplified?
No, I love simplifying things. I think you distilled that well. And one of the chapters in the book where it talks about how can you read, or how can you go look for scientific literature? The tagline is "Don't get suckered by testimonials," because a lot of times that's what sells, right? People go to either practice websites and they click on the testimonials, or when you see the infomercials late at night or sometimes early in the morning, and people are selling, either their stem cell clinic or their back brace or whatever it is. It's not really, here's all the data. It's really individuals saying, oh, I tried it and I loved it. And then usually there's a little, disclaimer at the end that, these results may not be typical, that kind of thing. And so it's just really educating people that, hey, you kind of, even though you might have a friend who did really well with XYZ, you still got to ask questions to figure out, is XYZ still right for you, even though your friend thinks that it was great.
Yes. So for those of you who might be joining late to the live stream, this is Dr. Marchetti, and he has written a book, which actually, let me see if our computer will cooperate with us here, which is this: A Buyer's Guide to Stem Cell Therapies, Safely Choosing the Right Regenerative Treatment for You. And what we're going to talk about is some of the aspects of what that really means, how to be able to get into the elements of understanding that. But for those of you who haven't really even heard of regenerative medicine, can you give us some ideas about what does regenerative medicine really mean?
Yeah, I think in the simplest form, regenerative medicine basically means you want to help tissues heal, and hopefully, ideally, heal back to their original state, right? So you're rejuvenating tissue. And that's really the basic premise of regenerative medicine, as opposed to, if you think about steroid injections, you're just reducing inflammation. If you think about, a lot of the orthopedic surgeries, you're just trimming out bad tissue, or you're replacing tissue with, kind of metal and plastic parts, that we would call a joint replacement. And so it's just really a paradigm shift of kind of going from that traditional treatment method to, can we find ways to actually have our bodies heal themselves as best as they can?
Okay, so normally when we think about regenerative medicine, people think about stem cells. And one of the major controversies out there is stem cells being touted as stem cells for everything. So can you give us an idea of what's the difference between stem cells, PRP, and embryonic type products?
Yeah, I mean, there's a lot there. I mean, obviously, the original kind of stem cells, involved embryos, right? Which is why they were so controversial decades ago. Um, but I haven't really had that be an issue. I don't have patients coming to me with the conception that stem cells has anything to do with embryos or anything like that. So obviously that's a whole other ball of wax. Whereas when we talk about stem cells, we're talking about adult cells that are from our bodies. The typical sources that we'll use in the orthopedic realm are going to be from our bone marrow or from our adipose tissue, which is fat tissue. We're basically looking at what are called mesenchymal stem cells that kind of live around the blood vessels, and they're there. I think of them as kind of foremen on a job site. When there's an injury, they get called into action, and their job is to coordinate the repair of whatever's been damaged. And so they don't necessarily go do all the work, but they make sure that the work gets coordinated properly. And so oftentimes when we have an injury, if those cells aren't functioning properly or there's some other disruption in the chemical signaling, an injury doesn't heal well. And so part of the reason why we have so many different products, like the PRP that you brought up, is that we want to try to restore that proper signaling to make sure that the cells in our body are doing their job properly, that the injury is getting healed well. And that has really stemmed from a progression of different treatments. I think the first one that I talk about in the book is something called prolotherapy, which came before any cell therapy. And that was where people were looking at injecting different substances to induce inflammation to try to get that signaling process kind of reset or re-stimulated.
So can I jump in and ask you a quick question? Because I think I may see where you're going. In your book, you talk about the aspect of kind of getting to that point of watering the lawn, adding weed and feed, and then planting seeds. Can you give context for that so patients can have some understanding about what does that mean?
Yeah, so exactly. I use that kind of example of the lawn as far as really looking at these different treatments and what they're capable of doing. And so when you think of just watering the lawn, you have a lawn already, you have the grass, and now you're just making sure that it stays watered. And that's how I think of as prolotherapy. In prolotherapy, we're injecting substances. These days, the vast majority of it is dextrose, which is like a hypertonic sugar. And we're trying to, just kind of get the cells in the body revved up so that they're doing their job. Whereas the next step is really kind of adding fertilizer. Now we're being a little more aggressive, and so now we're stepping up to platelet-rich plasma or some of the amniotic products that are out there where they're full of growth factors. And so those growth factors are further, improving that signaling that's part of that reparative process. But you got to have the cells there to respond to that signaling. If you don't have the cells, then the growth factors aren't really going to do anything. Whereas the next step would be what you think of as stem cells, where now you're actually putting cells in there that can also produce those signaling molecules and can hopefully be more aggressive. Like, if you have barren field, you got to actually plant some seeds. You can't just throw fertilizer. You can't just, throw water on it. But you got to actually have some seeds there in order to work with something. And so it's really just kind of a progression as far as, what is the strength or the aggressiveness of the regenerative treatment that you're thinking about. And obviously different conditions in the body are going to be more appropriate for those different types of treatment algorithms. So you might have an acute injury like a new ligament or new tendon tear that You may just need to put a little prolotherapy on it to get it, kind of spurred to action. Whereas if you have more long-standing arthritic conditions, then you're probably going to have to get more aggressive with something like a stem cell or bone marrow aspirate injection, that kind of thing.
Okay. There's a lot of stuff to unpack with that phenomenal explanation. Just for those of you who haven't really been here from the beginning, again, this is Dr. Jason Marchetti. He's written a book, A Buyer's Guide to Stem Cell Therapies, to give some insight. Additionally, just for those of you who may be in the location and area, he's located in Plano, Texas. This is their website, and we'll reference this in our YouTube link. In addition to their phone number, does a number of different treatments in addition to regenerative medicine, and treats a number of different areas, everything from knee to heel to wrist to back to shoulder, and really is a well-renowned and very well-spoken of physician. In addition to doing traditional regenerative medicine, he does other therapies and is located in this part of Texas. So back to kind of the nature of discussing regenerative medicine a little bit more, as we kind of also do our own little pub for our own channel. Can you tell us a little bit about prolotherapy and how long it's been around for, and why isn't it more well known?
That's a good question. I first heard of prolotherapy when I was a resident, so whatever that was, 15 plus years ago. And it was something that was kind of like, yeah, there's some weirdos who do this stuff, and they think it's going to help, repair tendons and ligaments. And then as I learned more about it, it's kind of the original regenerative treatment, where people are looking at, not just can we block inflammation and block pain, but can we actually help this structure heal? And more importantly, though, because some people will think of prolotherapy as, well, you're just injecting sugar water. But it's more than that, right? Because when you do a lidocaine and steroid injection for, let's say, knee pain, you put it in the joint and it reduces inflammation and people feel better for a while. Well, the problem with that is, particularly over the past 5 or 6 years, we've found that particularly at kind of high dose or regular doses of steroid and even some of the anesthetics like lidocaine and marcaine, those substances are actually impairing or damaging our cells, like our chondrocytes, and so can actually, in the long run, make arthritis worse, especially if you repeatedly do those types of steroid injections. So the notion that regenerative medicine is probably a better idea, it just makes sense to me. And more importantly, instead of just taking that sugar water and injecting it into the joint, part of the prolotherapy training is also looking at, what are the biomechanics that are going on here? Not just that somebody has arthritis in their knee and it hurts and we should put something in the knee, but really looking at, why is that knee wearing out? What is it about the person's gait mechanics? Or do they have some ligament instability that is contributing to the wear and tear of that joint? Because the prolotherapy treatment, again, isn't just putting stuff into the joint, it's also addressing all of the ligaments that support the knee and trying to tighten them up and trying to restore stability and proper motion to the knee so that it's not wearing itself out as quickly. And then on top of that, it's then not just doing the procedure, but then making sure that the person is, doing the proper physical therapy, that they have the proper bracing, that again, it's a multi-pronged strategy to try to optimize their mechanics, to try to protect that joint over time. And so again, I almost think of prolotherapy as a philosophy in addition to being a procedure.
Okay. So in your book, you also mention autologous type treatments and therapies. What does autologous mean for our viewers? And can you explain that in the relationship to different treatments that would be used?
Yeah, so when you start using terms like autologous, now we're talking about kind of cell-based treatments or biologic-based treatments. So not just medicines like steroids and lidocaine and dextrose. So autologous is going to mean that there's a substance, whether it's platelet-rich plasma or bone marrow aspirate cells that are taken from your own body, as opposed to what's called an allogeneic product or allograft, which is a product that is taken from somebody else's body. So, for instance, there are placental tissues, umbilical cord cells, amniotic tissue membrane. All of those are obviously taken from other people. And so those are allogeneic products versus the products that come from you, which are autologous.
All right. So I know for some of our viewers, the elements of trying to understand all that in one fell swoop is a lot. But your book really breaks down these pieces, and it also gives resources that patients can then be able to kind of use as a jumping off point to do further research. Can you talk about some of those resources that the book leverages for patients to be able to get further understanding?
Well, yeah, it goes through several. So one is, really just some resources on researching medical literature, right? So we have like PubMed, which is the NIH's or the government's repository of medical literature studies. So it kind of walks people through going to PubMed and entering different parameters to try to do a literature search and trying to hone it down into human clinical trials, so you're not reading every study about rats and things like that. And there's other resources, for instance, clinicaltrials.gov, which is a resource that lists what clinical trials are out there, because some people are interested in enrolling in clinical trials. And then there's other stem cell authorities that are, I guess what I would say, non-biased, or at least less biased, like NIH. They have it's called stemcells.nih.gov, and it gives a lot of really good background as far as what are stem cells, what again talks about clinical trials and why people would want to participate in those, funding opportunities. And then California has an Institute for Regenerative Medicine, so CIRM is the name of that organization, and it is kind of very pro stem cell, and it seeks to champion funding and research and things like that as well. And so there's a lot of good resources in all of those sites, and so I use those as examples of places that people can go to kind of get what I would call more reliable information, as opposed to going to YouTube and listening to Joe Blow talk about his treatment or that kind of thing, which some of those offer good information, but at the same time you have to understand that anytime someone is selling you something, you kind of have to take it with a grain of salt and research what they're saying afterwards.
Sure. So when we kind of get into the details of stem cells themselves, because that's what many people think, okay, regenerative medicine is all stem cell, which it doesn't necessarily have to be. And there's reasons for why it doesn't necessarily have to be, which I'll let you kind of clarify a little bit of that on your own. But one of the things that I'm kind of curious about is that you mentioned two different sources of stem cells that most people would traditionally utilize. And the one is bone marrow and the second is adipose. So really kind of taking cells from that bone, traditionally iliac crest, as well as being able to kind of get adipose, which everyone's like, oh my gosh, which I think needs to be kind of like clarified too, because people are like, oh, why would I not get a liposuction and get all this fat taken from me? I get two things in one stone. And I think that some of those things need to be addressed. Can you give us some insight about those, and why would you choose one versus the other, and what might you get as a benefit?
Well, this is kind of hotly debated. And obviously you and I attend many of the same conferences and listen to a lot of the same speakers and things like that. So the debate between what's better, bone marrow or adipose, has been around for years. I think right now, however, the FDA has been very, kind of anti-adipose, at least in the form of what's called stromal vascular fraction, which is basically where you take adipose tissue, so you take the fat, and then you have to kind of strip away the stem cells or the mesenchymal stem cells from those blood vessels from the fat, and you got to remove the fat. And so there's different enzymes that have been used in that to try to digest it. And what the FDA has said is that when you're doing that processing, you're now doing more than what they consider minimal manipulation. And so therefore they've said that this isn't something that is homologous use. And I'm using all these big terms, but basically what people have to understand is that when we're doing these types of tissue treatments, whether you're taking your own blood and spinning it to make PRP, or you're taking bone marrow and spinning it, it's your own cells. And so the FDA has said, hey, as long as you're using people's cells, that we know that's safe. We know that in the literature that's safe to do. But once you start treating it with chemicals, we don't know that that's safe. And now you need to go through an actual drug authorization or drug approval process in order to prove that it's safe and actually get an FDA approval. So that hasn't been done for SVF. And so adipose has kind of fallen out of favor just because of that. And there's been some negative outcomes for folks where, there's a case a few years ago where a clinic had injected some patients in the eye for retinal issues, and they ended up getting blinded. And so that kind of put the brakes on it. And unfortunately, or fortunately, anytime people are kind of going beyond what maybe we should be doing, the FDA has reacted and said, whoa, you guys got to pump the brakes here. So, I mean, I hope that answered your question. I mean, if that's at least in my mind, because of that, adipose is it may be great, but until we prove it and we prove that, adding chemicals is safe, or at least determining, what things we can do to make sure it continues to be safe, or what structures we can inject it into. Maybe the eyeballs aren't a great idea, but the knee is fine. Until we know that, the FDA has said, we're not cool with this.
Yeah, I didn't mean to put you on the spot with you having to make a decision about which is the ultimate, but more so to give understanding about what patients' experiences might be, and the value that there has been research in both areas, and there are different practitioners that might choose one versus the other. But in the course of having that explanation, one of the things that you mentioned is the FDA. And in your book, you talk very appropriately about the FDA and labeling that there are two camps of people who kind of think about the FDA's degree of regulation. Can you comment on that so that our viewers can have understandings about what those two camps are and their positioning?
Yeah, there's frankly probably more than two camps, but really it boils down to, there are some people who think the FDA is kind of not doing enough, that they're not regulating the stem cell, kind of quote unquote stem cell arena enough, and there's others who feel like they're stifling it too much. I think the truth is probably in the middle, and I think they've been doing a reasonably good job. And really those two camps are, there's providers. So us as physicians who we treat patients, we want to be able to offer our patients, what we think is the latest and greatest, and we don't want to be told what not to do. But at the same time, there are people who kind of push the envelope and they do things that end up harming people. And so I think it is appropriate for the FDA to come in and say, hey, there's certain things that we're not going to be good with, and here they are, and that may change over time depending on how things go. And then you have the other camp of folks that say, wow, none of this is proven, and nobody should be doing anything that is called stem cell because we just don't have enough proof yet. And I think those tend to be kind of some of the what I'll call the bench scientists who are dealing with these cells in the lab, and they're basically saying, that the products aren't ready for market yet. And to some degree, they're right. I think, the big push, at least from a, if anyone is going to get rich in this field, it's going to be whoever develops a allogenic product. In other words, a product that isn't from your own body, that's a vial off the shelf, that can be mass marketed and is proven and safe to use. And so there is a lot of research going on, multiple companies that are trying to develop that product. And again, if you're going to take an allogenic product, which means cells from somebody else, and we're going to mass produce it, put it on the shelf, put it on a vial, or put it in a vial that millions and millions of people can then be exposed to, yeah, it absolutely should be safety tested and proven and go through the drug approval process. But obviously, that's a very different creature than me taking my blood, spinning it, drawing off the platelet layer and injecting it back into my body somewhere, where that's been done many, 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 many times and has been proven to be safe. And so like I said, I think the truth is in the middle, and I think the FDA has done a pretty good job of saying, we're okay with things like PRP and bone marrow, but we're not okay with kind of running rampant with some of these other products or anything that they would consider not minimal manipulation. Again, certainly if you start adding chemicals to tissue, and we're not really sure how that's going to affect things. Those are the things that they really want to see more proof on.
Okay. So before we kind of talk on that a little bit more in depth and detail, we're coming kind of at our midway point. So we're halfway through, and I just really want to kind of emphasize, so that people can be able to make sure that they're taking advantage of this, is that Dr. Marchetti is the author of A Buyer's Guide to Stem Cell Therapy, Safely Choosing the Right Regenerative Treatment for You. And in addition, for those of you who might find yourself in the Dallas-Fort Worth, Plano, Texas area, he is located within the region which has the following website. He does regenerative and orthopedic medicine, in addition to physical medicine and rehab type traditional treatments of pain management. Everything from diagnostic ultrasound to orthopedic bracing to traditional regenerative medicine, with things like treating knees and shoulders and elbows and such. And his contact information can be found at this web address, as well as being able to call the phone number that was mentioned earlier, just so people can be able to follow up and see you in the future. As I understand, 972-776-2849. So again, thank you so much for joining us as we kind of get into the nitty gritty of some of the elements of that. You mentioned the aspect of allogenic type items. Can you talk a bit about amnion and umbilical cell therapies as kind of a jumping off point from there?
Yeah, and I've used both of those products. I think they certainly seem to be fairly effective, and patients, like I said, they do well with them. Not just mine, but I think people in general in the regenerative orthopedic realm have an issue, however, when those products are being sold to patients as a stem cell treatment. And again, you have to kind of really understand what it is that somebody is using. So for instance, a lot of the amniotic products are products where they take the lining, the amnion, that surrounds the amniotic fluid, or basically the fluid that the baby is growing in. And they process the tissue. Usually it's irradiated, it's dried up, it's it's put into sheets, sometimes into powder. But the bottom line is there's not any living cells in it. So the notion that product would be a stem cell product is totally false. But what it does have is growth factors. So I kind of compare it to PRP, right? PRP is platelet-rich plasma, and again, it has a lot of growth factors that are going to help the body heal. So that's the situation that I would use amniotic tissue in. And then you have other ones that are like umbilical cells, where they take that umbilical tissue, they freeze it, then it gets shipped overnight, you thaw it, you draw it up, you inject it, and you hope that some of those cells lived through that process. And obviously there's been a lot of debate as far as, what is the viability of those cells after they've been frozen like that. If they do survive, are they functioning properly? We don't know the answer to that. And they're certainly not all stem cells. There may be a small percentage of them that are stem cells, but a lot of them are going to be epithelial cells or other immune system cells, and they're all mixed together in that tissue that got frozen in that vial. So again, calling it a stem cell procedure is somewhat erroneous. And so when I talk to my patients, I tell them exactly what it is. It's either an amniotic product that doesn't have any living cells in it. The plus side of that is there's not any living cells that you're going to get an infection from, right? If there's some new exotic virus that is possibly going to get transmitted, that's theoretically going to get killed off when that tissue is irradiated and treated. Whereas if you take the frozen cells, and there is some virus that we don't know about, we're not testing for, it can get transmitted. And so that, even though it's a very, very low risk, that is a risk that I have to disclose to my patients, just like getting a blood transfusion. There's always a risk of getting something from that. So I guess the bottom line is those products are out there. I think they do have benefit, but they haven't really been researched. A lot of that is just kind of anecdotal, and I certainly can't compare one to another, because there's certainly no studies that have compared amniotic tissue to PRP or umbilical cell tissue to doing your own bone marrow aspirate type of treatment. But that's I think the big issue that a lot of us have is really seeing people who advertise those products as a stem cell procedure. They're charging thousands and thousands of dollars for it, as opposed to just disclosing, this is what it is, and let's just be frank and upfront about it. Doesn't mean there's anything wrong with it, but just, let's be transparent.
Exactly. And I think you've taken the very high ground and the appropriate ground of how to be able to kind of give context for patients and people who are trying to seek therapy. And this is not what they do on a day-to-day basis. And it's one of the reasons why we're having this live stream, and one of the reasons why I sought you out as an author and a speaker for us is the fact of the matter is there's a number of individuals that are saying they're providing one source, and they're not really providing that source. And so people are thinking they're getting something that they're not. And at the end of the day, without laying, accusations or disparaging various different disciplines and types of medical type practitioners, the thing that I really want people to be able to take away is, how can you find it out for yourself? So if your provider tells you something, you should be able to do the background research on that and say, hey, you know what? I found this. How does this correlate, or how does this equal what it is that you told me? If your healthcare provider or a person who's caring for you is really in your best interest, they should be able to own up and say, hey, yeah, this is what I like. This is what I'm doing. This is why I'm doing it. And this is what's providing you value, versus it being kind of like mirrors and smoke screens and other things that are just not a good endeavor for regenerative medicine, which I think is going to make it detract towards our ability to be able to impact people as new and further therapies come out within regenerative medicine. But this is me getting on my soapbox. Let me get down for just a little bit and let you kind of continue to talk about, things that are going on. Can you give us a little bit further insight about, so this is always a touchy topic, because I want to set this up appropriately. But there's a number of individuals who will come to regenerative medicine as a patient and say, you know what, I need my cartilage completely replaced because I'm quote unquote bone on bone, which is another discussion into itself. But there are certain treatments that are out there, like autologous chondrocyte transplantation, that is a surgical type option that's blended with some things. Can you talk about that when people have a question of that ilk?
Well, yeah. So you kind of hit on a couple of issues, but I guess to answer directly about the cartilage replacement, there's several different technologies out there that are FDA approved, and I think the first one was called Carticel. Now there's MACI, MACI. And basically what they do is the surgeon goes in and they find a good section of cartilage. So number one, you got to have some good cartilage. And they take that out. It then gets sent off to a lab and they basically grow a plug of cartilage. And then they mail it back, and that surgeon then goes in and takes that plug of cartilage and basically plugs your defect. So with that said, the limitations of it is you're plugging defects, and they're usually small. Let's say a square centimeter. Is typically this size. I can't. Don't quote me on exactly what the biggest size is these days, because I'm sure there's people pushing it to see how big they can go. But the point is, you can't do the whole knee, right? It's just for one area. Typically younger patients who've had a specific injury, a specific region in the knee, and so those treatments are appropriate for them. But all too often, as you alluded to, I'll certainly see a lot of patients who come in and they're basically bone on bone. They're already in talks of having a knee replacement, and they say, well, before I go do that, what could stem cells do for me? And so part of what I go over in the book is really, if you think about regenerative medicine, just conceptually, right? You're rejuvenating tissue, or you're allowing your body to heal from injury. And so you kind of have to have some good tissue to begin with in order for that to really happen or be possible. And so a lot of the studies that have looked at regenerative treatments, whether it's bone marrow or PRP, typically mild to moderate cases are going to do much better than severe cases. And that just intuitively makes sense, right? If you come in with a bone-on-bone knee, there's not a whole lot there to work with. So the notion that you can kind of regrow a brand new knee from nothing I think that's going to be a fallacy. And part of the problem is not only is the cartilage gone, but once you start getting bone on bone, now the bone is literally rubbing on bone, and so the subchondral bone gets damaged. And the subchondral bone is really the foundation of the cartilage. And that's where the blood supply goes to the subchondral bone. That's how the cartilage gets its nutrition. And so if there's damage to that subchondral bone, even if you could grow cartilage and slap it on there, it probably wouldn't survive because it doesn't have that foundation, that blood flow, that connection to good subchondral bone in order to help it stay preserved.
Okay, so now a real easy question. So then what I would have many patients say, and I'm curious as to your response, is, okay, so how can I get the best possible outcome? What do I personally need to do in order to make sure that I'm a good candidate, excluding the elements of looking at just what's going on radiographically or what's going on from a clinical exam standpoint? What can I do to be able to improve my outcome?
Yeah, so I think when are you going to start, right? And if you start as early as possible, number one is stay healthy, right? So eat well, exercise, don't smoke, avoid toxic chemicals, all of those types of things, because we know that the health of your stem cells, or really all of your cells, chondrocytes, fibroblasts, all of your immune system cells, those are going to be critical for you in order to be able to heal from injury. So part of the problem as we get older is, as we generally get less healthy, our cells aren't working as well, we don't heal as well. And so that's part of the problem. And so one of the issues with doing an autologous procedure, if I take my my mesenchymal stem cells from my bone marrow. Well, if they're not really great functioning cells, then I may not have as great of a response to them. And so that's number one, is just kind of being healthier. You're probably going to have a better outcome in general. The other question that I often struggle with is kind of, when do you do the procedures, right? Because we know how to do them very well. But again, if most patients, as they kind of wait until things are really awful, they're probably not going to do as great as if they kind of came in when things weren't so bad. And so you can imagine if you've only lost 20% of your cartilage, then we have a lot to work with. We can do a lot better than if you've already burned through 90% of your cartilage. So I tell patients, you may not have to spend a lot of money on a bone marrow procedure every single time you hurt, but at least think about prolotherapy, at least think about PRP when you do have an injury, or if you start having, for people who have arthritis, as they start to become symptomatic, I like to see them kind of sooner than later, not necessarily, every time, 1 week after they hurt type of thing. But, if their pain is clearly kind of starting to come back, don't wait until it's a 10 out of 10. Come in when it's a 5 out of 10.
Okay. So can you talk a little bit about what is an exosome? What really is that? And what's the value in looking into that further?
Yeah, so now we're just expanding the products, right? So exosomes are an allogeneic product, which again means it comes from somebody else. And the notion of an exosome is that if you look at how our stem cells work, they are, again, they're the foreman at the job site. So they release all of these signaling chemicals to tell all of the other cells in our body what to do. So somebody came up with the idea that says, well, maybe I don't need a cell to do that. Maybe I can just get those chemicals in little packets that we'll call exosomes, because that's basically what cells do, is they put those chemicals into little vesicles and then secrete them out the cell. And so what these guys have done is they've taken cells and have them make packets of those chemicals that we call exosomes. And so now we have products that, again, they're available in a vial. And so instead of injecting cells, just injecting those chemicals that the stem cells would be working with. So, I think there's certainly value in that concept, but obviously we're still at the process of trying to prove that is a viable alternative. And again, anecdotally, there are people who say, "Oh my gosh, this stuff is great." I personally haven't gone there yet. I think I'm still waiting to see if it proves itself. Especially when you look at the relative expense of all of these products, I haven't been convinced yet that I need to offer it. But again, it's stuff that, if somebody came to my office and said, I absolutely want exosomes, I want you to order it, and I want you to put it in my knee, I'd probably do it.
Okay. So thank you. What is a common myth about regenerative medicine, and can you debunk it for us?
Well, I think, I think the common myth is, again, the belief that, you're going to do a procedure and kind of be one and done, right? That, I'm going to put a stem cell in there, my knee's going to regrow, and I'm going to have 20 years of doing awesome. The reality is when we look at how long these outcomes are staying good, it's maybe a few years. And even for platelet-rich plasma, we're seeing outcomes of at least a year or two. And so, but they are things that have to get repeated. They're not just things that, again, you do it once and you're great. So I think that's probably the biggest myth, is that you're going to be 18 again, and for 20 years you can do great. Do you have any other myths that that you had in mind?
No, I think that that's a phenomenal answer. I think it is something that is frequently shared from a lot of different patients. Um, the thing that I would be curious about from a regenerative medicine standpoint, that I think really is one of the things that is sometimes glossed over as we, and what I mean by this is, as providers, both yourself as well as I, we do regenerative medicine, but we do it in context with some other treatment options. And we also know that there's some pluses and minuses to those other options. But if I'm going to kind of paint the picture of looking at regenerative medicine versus traditional pain that's focused on the steroid use, can you give me a contextual understanding of what's the benefits and pros and cons, if you would, of that from a patient's perspective?
You mean as far as them weighing, like what treatment am I going to do today type of thing?
Yeah.
Yeah.
And as well as what their outcomes might be, what's the positive elements and what are the downsides of each?
Yeah, well, I mean, obviously, cost always becomes a thing, right? And so when you start talking about regenerative treatments, PRP, bone marrow, amniotic tissue, exosomes, whatever, those tend not to be covered by insurance. And so there tends to be an escalating cost depending on what you have. And so when you look at our traditional treatments, whether it's steroids or surgery, those are things that are, covered by insurance. And so are at least financially more attractive to patients. There's other pain interventions, like peripheral nerve stimulators or spinal cord stimulators that can help with pain. Radio frequency ablation procedures, all of those traditional pain management procedures that we do, can help patients. Again, as you said, they all have kind of their pros and cons. But that's the discussion that, kind of part of the emphasis in my book is really, here's the knowledge you should have. Here's some of the questions you should be asking. But at the same time, there's probably not one treatment that makes sense for everybody. There are some patients who, maybe the best thing for them is a rhizotomy type of procedure to buy them some time just from a pain management standpoint because it's affordable and, they may not have a really active lifestyle and it buys them some time before they have to get that knee replacement or whatever it is. So that tends to be the biggest thing is just really, what financially is reasonable for folks. And there's other people who have a blank checkbook and they come in and they go, well, I don't care if it doesn't work. I want to try it anyway. And that's great. That's fine. But I just try to be as upfront with people. Again, it kind of depends on their condition, whether we're talking about a tendon or a ligament or mild arthritis, advanced arthritis. What my understanding of their condition is, what I think their diagnosis is, and what their chances are of having some meaningful improvement from a procedure, particularly if they're going to spend money on it. I want to be upfront with them and lay out realistic expectations.
Okay. So as we start wrapping up, I guess the thing that I would be most curious about is, so particularly in the context of talking about the book that you wrote, what's the main takeaway that patients should really have in understanding the value that that book can provide to them and what they can really be able to garner? And just for those of you who might be, again, joining us late, the book is the following: A Buyer's Guide to Stem Cell Therapies. And Dr. Marchetti, can you give us some insight about that, please?
Yeah, I think the biggest takeaway would be it's actually a very easy read. It's not a long book. The language is, I've had multiple people tell me, man, I was really intimidated at first to think about reading this, but I actually read it and it really made sense. And I appreciate the insight. And I think that's really part of the take home is I really try to tackle what can be a really scientifically complicated subject, try to distill it down and really say, look, here are the highlights. Here's kind of the parts that you need to understand from a buyer's perspective, because that's what patients are. They're deciding whether or not to shell out money for a procedure. Again, just trying to give them tools to be able to analyze what's being offered to them, what is out there in the marketplace, what questions to ask, what resources to look at before they, actually make the leap to commit to a procedure. And again, with the knowledge that the science changes over time, and so what was true in 2017 may not be totally true now, and may not be totally true 2 years from now. So I wanted to kind of have a more of a timeless education how-to book, as opposed to here's what's good for me, that kind of thing.
Well, again, thank you so much for doing us the courtesy of allowing us to be able to pick your brain, get kind of behind the scenes of understanding the book and how it can be able to help people who are interested in regenerative medicine. If there's a takeaway in terms of where regenerative medicine is going, which I think is a really challenging question, but I think that you're more than up to the task, where do you kind of predict where you think regenerative medicine may find itself in the next few years or so?
Well, I think, there's a few areas. So number one, I already talked about allogeneic products. And so I guess I'd be remiss to not bring COVID-19 into the study, into the talk today, right? It's all the rage. But you might remember there was a company called Pluristem that initially, when COVID came out, they did some studies on the cytokine storm of COVID-19, and showed that, and they have basically a placental cell product that they could reduce that cytokine storm. So I think you're going to see regenerative medicine, and it already is. It's not just orthopedics. It's really looking at anything to do with the immune system. I got on my Twitter feed just yesterday. There was news on a company that is making what's called an induced pluripotent stem cell product for basically immune therapy, which is a type of therapy for cancer, where they're using these cells to basically attack the cancer cells. And so, I never thought induced pluripotent cells would become marketable, because what people have to understand with those cells is that they basically take a cell, hammer it with a bunch of chemicals to try to make it a stem cell. And so as far as like a safety perspective, those are the ones that we all go, oh my gosh, are you going to put that into somebody and it's going to cause a tumor, cause cancer? But we're at a point where the FDA is, or there's a company that has that type of product out for FDA approval. And so I think it's going to be really exciting 5 or 10 years, not just in orthopedics, but I think for cancer, I think for neurodegenerative processes, really for any sort of inflammatory process, whether it's heart disease or liver disease, any of those types of things. It's going to be exciting.
Okay. Again, thank you so much for joining us. It's been an absolute pleasure. For those of you who have been unable to catch the full aspect of the broadcast, this will be saved on our YouTube channel, and it will be both myself as well as Dr. Marchetti who has access to that. So you can go to either of our Facebook pages and be able to access it, or to our YouTube channels, and you can be able to kind of take a look and sort of glean some of the information that we covered today. And again, it's been an absolute pleasure. And hopefully at some point in time, you may even grace us with being willing to come back in the future and kind of talk a little bit more about regenerative medicine.
Well, Orlando, it's been a pleasure to see you again. And I always look forward to seeing you again in the future.
All right. Take care. Thank you so much. Have a great day.
You too. Bye-bye.